Hi ladies, this is Dr. Farag. I'm an OBGYN in Mission Viejo and I'm board certified in OBGYN. And today we're going to be talking about the Femilift treatment and helping you learn about some of the treatment options that are available for some of the common health concerns. We brought this technology to the office to help people be more comfortable in a way that is very easy and also with no downtime. We also want to make sure our patients are aware of their treatment options. And so even though I do surgical procedures and I do minimally invasive surgeries, this is a wonderful opportunity and treatment option for a lot of patients that can be done in the office and they can avoid surgery. So we're going to talk about the Femilift today, and I'm going to go over some information to help you better understand how this technology may be helpful for some of the concerns that many of our patients have. A lot of people come to the office and they see me as their OBGYN for various issues, but they're nervous or embarrassed to talk about some of the concerns that many women have. And if there's a place where you can be comfortable to be yourself and talk about any issues, it should be your OBGYN's office. And I'm glad that I'm here to help our patients learn how to take care of themselves better and help them be more educated about their treatment options. And that's what we're here for, to help you feel better. And a lot of people don't realize how prevalent these problems are. A lot of women have these issues, and as you can see here, a third of women over the age of 40 will actually have a feminine health issue, and half of the women over age 65 will definitely have a pelvic health concern that will be affecting their quality of life for the duration of the rest of their life in menopause. Because menopause, as some people may not be aware, begins when you stop having periods, and it is the rest of your life thereafter. So it's not just for a few years, it's the rest of your life after you stop having periods, and that hopefully will be many decades. And we want people to have an excellent quality of life so that they can enjoy all those years. So a lot of women have these issues, and as you can see here, it affects more than 15 million women, and they suffer from a variety of different symptoms, some of which just are bladder symptoms. And as you can see, at least 30% of women will actually suffer from stress urinary incontinence. And that is a problem that women have with leakage of urine that can happen when they're laughing, coughing, sneezing, jumping, running. And so a lot of women are affected by this issue, and their quality of life and their activities are modified as a result. And then as we get older, those issues get even worse, because over 50% of women will have issues in menopause that are also added to by the vaginal dryness, which is called atrophy in menopause from the changes in the hormones. So not only do they have bladder issues, they also have issues with vaginal health and painful intercourse, as well as increased infections of the vaginal area as well as of the bladder. And so these are symptoms that affect many women over the years and definitely affect their quality of life. So common feminine health concerns that affect a lot of women have to do with multiple issues, and you can see the list here. It begins with having had children. For many patients, when they develop vaginal laxity, they also will develop vaginal dryness that develops in menopause as they transition into those years when they're no longer having periods, and that dryness can lead to tightness of the vaginal tissue, and atrophy is what is the term we use for a lot of these changes in menopause, and that combination leads to painful sexual intercourse, and that is called dyspareunia, and that comes from the tightness and the dryness that gets worse over time. And when you add that to the bladder issues that some women also experience with leakage of urine when they do their normal activities, or having that urgency to get to the bathroom quickly and not making it and leaking as a result, those are all symptoms that definitely affect the quality of a woman's life. And fortunately, we have ways we can remedy that. And you'll see that the treatments are targeted at helping women get a change in the vaginal tissue that's going to bring it from the menopausal state back to how it used to be before they were menopausal. And that's what this picture shows you. Is on the left, you see a picture of the tissue when it becomes menopausal, it becomes drier, and that top layer becomes very thin, compared to someone who's premenopausal, which is pictured in that right image. And you can see how thick the tissue is. It has a lot more of the white, which is more moisture, and so definitely a huge difference from premenopause to the menopausal state. So what are we doing about these issues now? And you can see in the options of treatment here, the list of the common treatments, and there are over-the-counter vaginal moisturizers. There's also lubricants that people try for vaginal dryness, and then estrogen therapy, which we can use either locally in the vaginal area or systemically to help address some of those concerns. Pelvic floor therapy is a biofeedback therapy, and it's a treatment that is usually at least 3 times a week. Some patients need 6 days out of 7 to get the pelvic floor is stimulated to a point where it helps support that area. And then pessaries are used as well, which are devices that you would insert into the vaginal area to help physically support the bladder when it's falling. And that is a treatment that is addressing the bladder issues, but not addressing the dryness or the vaginal atrophy and the painful intercourse. Surgical treatments also are focused on helping restructure that area so that you have the support that is needed when people have bladder problems. But again, they don't do anything for the vaginal dryness or the painful intercourse. Actually, the scarring that develops and the tightness that develops from these surgeries can sometimes make those symptoms worse. So fortunately, now we have new advanced technology, which is the Femilift technology that we'll talk about a little bit further in the next few slides. But some of the common remedies that are available on the market today include the estrogen creams, which one company is called Premarin. So the Premarin cream can cost about $285 per month, or whatever the copay is. For a lot of menopausal women, hormone replacement therapy, unfortunately, is not covered by Medicare. So it ends up being a cash service, so patients have to pay that each month. Another treatment, which is a vaginal estrogen, can be about $134 a month. The S-ring is a ring that releases estrogen inserted into the vagina and replaced every 3 months, and you can see the cost there. Osphena is an oral tablet that is not a hormone, but is a medication that can sometimes have similar side effects as hormones, and it's an oral treatment that costs about $150 a month. Replens is a lubricant that's available over the counter, and it's an example of many of the lubricants that are out there, and those are also at a cost each month, and they have to be used with each sexual activity to help that area be more comfortable. And it's kind of like putting a band-aid on an injury. It doesn't solve the problem that's causing the injury, but it just kind of gives you a little bit of relief, but not much relief. So that is definitely an option. All of these treatments are options, but they take they require rather the need to use them on a regular basis, at least 2 to 3 times a week, if not every time. What is ACOG, which is the American College of Obstetrics and Gynecology? They give us recommendations and committee opinions, and this is the standard of care that physicians usually follow. And so they're recommending, and they're using breast cancer patients as an example. And of course, we never want to expose patients to more medication that is needed. So for some patients that are having these symptoms, they're recommending non-hormonal approaches first. And then of course, if they need to be on anything that is hormonal, it's for the shortest amount of time. However, most patients who've had cancer, especially if it's a hormonal cancer, we don't want to use any hormones. So that leaves us with the other options that we just reviewed, which are not very effective and definitely require a lot more self-administration, if you will. And so the treatments with the Femilift are definitely an excellent treatment option for these patients, or for any patient who wants to have relief of their symptoms without having to use a medication 2 to 3 times a week or every time that they're sexually active. So what is the Femilift? The Femilift is the best invention in women's health, I think, since epidurals. It's really come a long way. You know, medicine has changed a lot. We've been using lasers in different treatments surgically for many, many years. I've been using lasers for 25 years, and thank God now we've got laser technology that is compact and safe, and we can use it in the office. We don't have to do it at the hospital. And that's what the Femilift now provides. It provides a gentle treatment, which is a CO2 laser treatment that is vaginal, and it has been clinically proven with studies to bring lasting relief. So these treatments are very effective, and they have an overwhelmingly positive response from our patients, and it truly is life-changing. So why are we using these treatments, and how does it really help, and what are the applications? So you can see that for patients who are having issues with the dryness that affects their intimacy, gives them pain with sexual activity, or just discomfort or recurrent infections. Some patients are having those bladder issues that we talked about, but some patients can also develop inflammatory reactions. One condition is called lichen sclerosis, and that can also be treated with this laser treatment. And what is it doing exactly? It's actually creating laser treatment in the vaginal area that helps your body build in a natural response to bring in new blood supply and help that area get more naturally moisturized and lubricated, as well as giving it new collagen, which helps it be more elastic so that it's more comfortable in general and healthier overall. So the device you can see in this picture here on the left is the Femilift treatment. And as you can see, creates these little micro injuries in the tissue with the little dots that you see in the right picture in the vaginal mucosa. And it also has a heating element which helps regenerate the collagen in the vaginal tissue. So as you can see, the device goes into the vagina all the way to the back of the vaginal canal. And the treatment is started at the very back, and then we come out 1 centimeter at a time, rotating in each level 360 degrees, so we can provide a treatment in all of the surfaces of the vagina. And every time the laser actually deploys, it gives off 80 different beams that treat 80 sites of the vaginal mucosa. And that's how you get a really great response, because we do 3 passes every time a patient gets a treatment, and it covers a large part of the cervical mucosa, so you get an excellent response all the way around from the deepest part of the vagina all the way to the vaginal opening. And then this is what happens. So before we treat patients, you can see the mucosa is that picture on the left. And then after a single treatment, 60 days later, you can see what happens to the tissue, and that's the picture on the right. And if you remember the slides that we looked at earlier, the thicker tissue that had all of those white pockets was the lubricated tissue of a premenopausal patient, and the thinner tissue was the tissue of a menopausal patient. So I'm going to go back to that slide. So keep in mind that we're looking about the thickness of that top layer. So I'm going to quickly go back, and you'll see me switching here until we get to that slide that I mentioned. Oops, there it goes. All right, so on the left is a menopausal patient, and on the right is a premenopausal patient. So you can see from the picture on the right of a premenopausal patient how the tissue should look. And then you can see in the next image that I'm going to show you on the slide after the Femilift treatment, how the tissue has changed. So keep this picture on the right in your mind. The picture on the right looks very similar to that premenopausal patient that you just saw. And this is 60 days after 1 treatment with the Femilift. So we're definitely seeing an excellent response from the first treatment, and it just continues to get better with subsequent treatments. And we've had studies that have looked at this from all over the world. Experts have been testing this technology in different countries, and they've all come up with the same results, and it's been consistent. And that's how we've developed our protocol to treat patients with these issues, so that we get reliable results that are safe and effective, and we can do them in the office, and every patient sees excellent results. And so what is the difference between the treatments out there? A lot of patients now who are researching these treatment options are looking at various treatments. There's laser treatments, there's radiofrequency treatments, which are called RF treatments. So what is the difference? How do you decide? How do you pick the right treatment? And so this is a nice comparison here to show you what the laser can do. So laser treatment is a CO2 treatment, and it's an ablative treatment. So it controls the dermal micro-wounding that we saw, those little injuries that we see in the tissue that help it rebuild, and also has a thermal component, which is the heat component, that helps bring in the collagen and helps strengthen the support in those areas. With the laser, these treatments are done in 10 minutes, a really quick office procedure, and thousands of treatments have been done with no adverse events. However, the radiofrequency treatments, they do have some effect. However, they're only thermal. They take about 30 to 40 minutes, and they definitely have had some adverse side effects out there with the different technologies. And so when you're comparing technologies, the best treatment is the laser treatment. So now how do you pick the Femilift? Because there are other laser treatments out there. So I'll talk to you about a little bit of the changes that people have and how the remodeling affects their life. And you can see that people have had long-lasting results, and they definitely get relief of their symptoms. And the most common issues, as we discussed before, are the discomfort that they can have with sexual activity from the dryness and from the lack of lubrication, the laxity that develops from childbirth and having less sensitivity in that area, which makes sexual activity not as pleasurable, and also having issues with the control of their bladder, which has to do with the laxity of that tissue as well, and the relaxation of the bladder into the vagina. And so for many reasons, patients are getting excellent responses from these treatments, which are affecting their quality of life. And what are the patient benefits when we do these office laser treatment. Obviously, it's an office procedure. It's not a surgery. There's no anesthesia required. It's virtually painless. Patients really notice that it's a pressure sensation similar to your pap smear, and it's not painful, and they can go back to their normal activities right away. There is no downtime. The procedure takes less than 15 minutes. And at the same time, the procedures are spaced out every 4 weeks, which is usually very manageable in a patient's lifestyle. So they can come in once a month, get 3 treatments, and that's the protocol that we recommend. So when they get these 3 treatments, they're spaced about 4 weeks apart. As I mentioned, they're less than 15 minutes in duration, and all they need after that is a maintenance treatment once a year. And that just helps them maintain the great results that they've achieved with the initial protocol. And it's really simple to do. Patients don't have to do any treatments every day. They don't have to put anything inside the vaginal area. They don't have to take medication orally. It works. It just helps that area regenerate, reheal, rejuvenate, and that's why it's very effective, and it's very, very helpful for a lot of these concerns that women have, and patients will notice improvement right away, and they'll continue to see that improvement for the next year, and it continues to get better as time goes on after the treatments when we do these treatments on a maintenance program yearly. So after the treatment, what do you need to do? So as we said, there's no downtime. The only thing that you need to avoid is anything in the vaginal area for 3 days. And so no sexual activity for 3 days, no use of tampons. Also, patients should not be sitting in any water waist deep. And so that's really the only thing you need to do in the post-treatment 3 days. So you shouldn't worry about not being able to do your activities. You don't have any pain that you need to lay low for. So it's really excellent. People have hardly any side effects. The only thing you'll notice is a watery discharge, which is very manageable with a light pad. And otherwise, just normal activities. So people don't have to change their lifestyle. And they come in just every month for their treatment, which takes less than 15 minutes. What does it cost, which is always an important factor for a lot of patients. And the insurances do not cover the Femilift treatments because they're considered aesthetic, although as most of us know, these issues are not aesthetic issues. These are definitely life altering symptoms that patients will have, and it'll keep them from doing the activities that they enjoy and want to do. And so this is really a medical problem, but sadly the insurance industry does not see it as a medical problem. They think any laser treatment is the aesthetic treatment, and so it is not covered. So the good news is that we definitely have ways to help you get this done, and for anybody who wants to do it, we can definitely figure out a solution. So the national average for these treatments, again, the protocol of 3 treatments for the best results is $4,000. But to make it available to our patients, and we want everybody to do it who needs to have it done, we brought the price down to $3,200 when you do the package. And if patients are signing up after seeing this webinar, it's going to be $3,000. And that includes your personal sleeve. We didn't actually talk about that before, but the unique feature of the Femilift is that it has a personal sleeve, a device that is just used for you. So it is not used on any other patient. It never touches anybody else. It's a hygienic sleeve that is dedicated only for your treatment. And you can see in the picture here on the right, that is the sleeve, the shiny part that you see on the applicator there at the end of the device, and that is used for your treatments. And so that sleeve is included at no additional charge. And then in the future, you just need 1 maintenance treatment in 1 year or every year thereafter, and that's the single treatment cost of $1,000. And patients who want to do it and want to use their credit card or can't use their credit card, we have options like Care Credit, which can be used for any healthcare treatments. And if you have a flexible spending account or an HSA account, those can also be options that you can use in our office to pay for these services. So who cannot have these treatments? You can see a list here of the patients that should not have it. Basically, it's anybody who has significant bladder prolapse or organ prolapse. If the anatomy just needs to be physically repositioned surgically, of course, the laser treatments are not going to be enough. For patients who've already had surgery in that area and they've had mesh or a type of sling implanted in the vaginal submucosal area, then those patients would not be able to have this treatment either. And for patients who have photosensitivity issues, which may be from medications that they're taking, or patients who have had issues with infections or ongoing infections, those patients, like the patients who have herpes or who have had the human papillomavirus affecting that area at the time of their evaluation, they should not be having this treatment either. However, once their symptoms resolve and they no longer have issues, they can get treated. Same thing with patients who have uncontrolled diabetes. They're more prone to infections with any treatments or surgical approaches, and therefore their diabetes needs to be controlled before they have these treatments. And anybody, of course, who has an ongoing problem that has not yet been evaluated properly, whether it's abnormal bleeding in menopause or they actually have a malignant process going on, those would not be patients that should be getting this treatment at this time. Although breastfeeding is not really a contraindication, where the laser is not going to affect their breast milk, anybody who's pregnant or breastfeeding falls into a category that we always want to be super careful with, and therefore we recommend that they wait until they're done with their breastfeeding to have these treatments. And then, of course, anybody who can't follow the protocol and is not willing to follow the protocol should not be doing the treatments either. We'd love to see you soon. Come on in and make your appointment for your complimentary consultation. We can talk about your particular concerns and have a private consultation. And we'd love to educate you more about the services we provide in the office. Feel free to call anytime. You have our number here. You've got the website as well that has information. And hopefully we'll see you soon. Thank you for listening to the webinar. Have a great day.